Hi there, and welcome to another episode of Health with Dr. Yvette Maseka. This is a podcast that aims to correct myths around health. And today we're going to be talking about something that affects a lot of us, and this is mental health. I know a lot of us are busy throwing around the term, my mental health and whatnot. So today we're going to talk about it. And I'm joined by Namatama Luwinda. I'm going to allow her to introduce herself. So, thank you for joining us today.
Thank you for having me.
So, who is Namatama Lubinda?
Namatama Lubinda is a person who loves life and loves people. Profession-wise, I am a medical licentiate in psychiatry and also a mental health activist. I am also an author of 3 books so far.
3
That's
books.
basically it.
3. Yes. Okay. What are they called?
So there is How to Cope Without Dope. That's the physical one. There's a physical and an ebook, and then there's Sekelela, and then the last one is a weight loss guide.
Oh, okay. So, I know about how to cope without dope. And where can we get these books?
So where you can get the books are not yet in bookstores. So you can contact me on my Facebook page, Namatama Lubinda, also on TikTok, and we can make arrangements.
Okay, I'll definitely get some copies. So, what is mental health? I personally don't know how to answer this question, so I'm really looking forward to what you're going to say.
Okay, I'll give you the simple definition of mental health, which is basically the state and quality of 3 things: your thoughts, your emotions, and your behavior. So when it comes to mental health, the WHO definition talks about somebody who is able to make a contribution to society, somebody who realizes their potential, and so on and so forth. All those things can only be achieved if our thoughts, our emotions, and our actions or behavior are in check.
Oh, okay. That's something. How do you okay, why is that important? Why should we make sure that our mental health is in check?
Okay. So all these things, these 3 things, the thoughts, the emotions, and the behavior, all start from the mind. So we are our actions. The thing that causes us to do what we do is our emotions. And the emotions come as a result of thoughts that we may have. Meaning that for you to take care of the results of your daily life, you have to first take care of the first thing, which is the thought. When we have issues with our thinking, our emotions, and our behavior, this can significantly impact our lives. Many people with mental health issues are not able to live their lives well because of that particular issue. In as much as the problem may not be physically crippling, mental illness can literally be crippling. Someone can be dealing with depression, which many people see as something so small, but that depression can be so severe that that person is not able to function. So if we do not take care of all those aspects, we cannot become the people that we are meant to become. Additionally, mental health, in one word, is simply happiness. If you have issues in those 3 aspects of your life and you are not able to handle them in a healthy way, you can never be happy.
Okay, so mental health is important for us to function well in society.
In society and even just as individuals.
Okay, and also in our various relationships, I would assume.
Yes,
Yeah.
definitely.
So what are the factors that influence our mental health?
Okay, so when it comes to factors that influence our mental health, there is something that is called the biopsychosocial model. So this talks about the three groups of things that affect us mentally. So we have the biological aspects, which can be diseases, trauma, especially head trauma. Those things can lead to mental health issues. Okay, and then the psychological aspect. This refers to how you think, how you process thoughts, how you deal with issues, how you understand issues. Okay, yeah. And then when we talk about the social aspect now, this is the environment. So the people that you spend your time with, things such as the food that you eat, even though that can fall under biological, but it can also affect you in the social aspect. So some of the things, to give specific examples, one of the most common things that causes mental health issues is abuse.
Yeah.
And when we talk about abuse, I'm not only talking about sexual abuse, because that's the form of abuse that's most talked about.
Yeah.
There's physical abuse, there's verbal abuse, there's psychological abuse, emotional abuse. All these things are able to cause somebody to develop a mental health issue. Even if you haven't been abused, things such as neglect, adverse childhood experiences, there are certain things that children will go through that will affect them for the rest of their lives. Losing a loved one at a young age, growing up in a broken home, being bullied. Those are psychological aspects now, because those are the ones that shape the way you think. So, yes, those are some of the things that can affect one mentally.
I think something that affected me in school was being bullied. I think there was some element of being bullied. So when I changed schools, I decided to become the bully instead of being on the receiving end. And I always wonder if that ever affected someone out there, and it's very sad. So how do you think schools can implement measures where there's this reduced bullying and things like that, either from their peers or maybe even from teachers? Because there's some things that teachers can tell you that can really affect you. Because one time I remember one of the teachers told me that I am a bad influence. I don't know what I did, but she told me that, and that I couldn't become a prefect. So it was me and my friend, and she was like, you guys can never become prefects. And being a prefect came with some, some perks. So that kind of affected me. Like, why is she looking at me as someone who cannot lead? That really affected me. So how do you think schools can improve on that?
Okay. I'm glad that you gave the example of the teacher, because teachers are often children's first bullies.
Yeah.
Well, after parents, but then if someone comes from a healthy home, if a teacher bullies them, that would probably be their first bully. And when something comes from an elderly person, it affects you differently than when it comes from somebody who's your age. So first of all, there is need for these teachers to be trained on how to handle children, how to handle children's emotions, children and adolescents' emotions, how to relate with these people. I believe that in teaching, there is an aspect of psychology. So it would be good if that aspect of psychology can be expanded to actual mental health and even just the basics of counseling. Because when a child is going through something, the person who sees them the most is a teacher. And so they should be safe spaces for children. So besides the teachers being educated, there is need also for the children to be educated about mental health. You mentioned that you were bullied, and as a result of that, you became the bully. Had you been given the help that you deserved, probably it would have turned out somehow else. Imagine how many adults right now came from a background of being bullied, and even up to now, they are bullying people. And bullying in society is severe. That's where you see toxic bosses,
Yeah.
narcissistic partners. You just become a bully for life. So there's also a need for schools to have functional counseling departments. Guidance and counseling department is there, but then what happens? These people go to see a teacher who is not a trained mental health professional. And in some cases, you'll find that the teacher is actually the trigger. So there is need for schools to employ people who are specialized in mental health. Okay? And then another thing that schools can do to help this mental health issue is during PTA meetings, the conversations shouldn't only be about the school's infrastructure, about money, about programs. Those programs should be opportunities for the teachers to discuss the state of their children. Parents don't spend as much time with their children as teachers do. So if the teachers can get that information quickly, give that information to their parents, and the parents find a solution for what their children are going through, I think many people will be helped, and many people, I think, will realize early that some of the behaviors that they have are as a result of trauma.
I think so. Does that apply to workplaces? Should they also have a trained counselor to attend to people?
Definitely. Because many people are functioning addicts. Many people are living with a high functioning depression. And like I said earlier, if you are living with a mental health issue and it's not being dealt with professionally, the chances are that you will not become the best version of yourself. You will not even know your full potential. So it's very important for that to be done. And additionally, I think it would be a good step for companies to include mental health assessments along with the medical assessments that they require. The state of somebody's mental health is going to determine how productive they're going to be, how motivated they are going to be, and if the people in the company have a good mental state, that affects the overall performance of companies. So it would be a huge investment.
Okay, but how can we sort of change the mindset of people? Because I'm sure some people don't look for help because they're scared that they may be seen as crazy. Everyone wants to come out as being okay. But if they see you going to see the counselor, they may be thinking, okay, why is she going to the counselor and things like that. So how can we change people's mindsets in terms of that?
I think changing people's mindsets is something that does not really depend on us, because a mindset can only change when the person decides that they want to change, or maybe if they have an epiphany, But I think us continuing to have such conversations and normalizing people opening up about these things I think it would do something. I've seen change in the years that I've been in advocacy. Initially, the response was, what is this? What is that? What is this? So there's a need to help people to understand things from the foundation. Mental health is something that people think is difficult to understand, but the truth is that we already know these things. We just don't know that they are mental health issues. And what people often need is somebody to explain, Kuti, okay, look, your child has been sleeping the whole day. Think about it this way. What if they are depressed? They might not just be stubborn. So educating in those small aspects, I think, is bringing about the change that we desire.
And it's good you talked about a child, because most people think depression is for adults. They'll be like, you're a child, what do you have to be depressed about? You have no bills to pay, you're just out there living life. But without them actually knowing that depression can affect anyone, even infants can get depressed. So I'm glad that you came up with that point. So apart from depression, what other mental illnesses are common, especially in our setting?
Addiction.
Oh, yeah.
The statistics say that depression is the most common, but I believe that addiction is the most common. And the problem is that it's just not spoken about enough. And also the awareness and the understanding of it is not adequate. When we talk about addiction, what often comes to mind is drugs. But then the thing is that anything can be addictive. There are people who are addicted to sex. More people are addicted to pornography than people who are addicted to drugs. There are people who are addicted to gambling. There are people who are addicted to being violent. There are people who are addicted to food. And this is something serious, regardless of what exactly the person is addicted to. There is the effects on the brain are literally the same. Some people are addicted to love, and some people are addicted to toxic partners. Yeah, we had a conversation earlier.
Yeah,
We were talking about toxicity.
Yeah.
And, I mentioned that what happens when somebody is addicted to a drug is the same thing that happens when somebody is in a toxic relationship. You know that this person is wrong. You
Yeah.
see the negative effects that they are having on your life, but you just can't leave. That's the same as addiction. Another common mental health issue is anxiety. Anxiety is not talked about enough.
No, it's not.
It's often seen as something else. Some people have social anxiety, and so they will keep to themselves. Society will see that person as antisocial. Some people get anxious when they need to do something like speaking. Some people will see that as a lack of confidence. So it's in these, behaviors that we don't really pay attention to that you can see that a lot of us are struggling with mental health issues.
Like, I remember I had anxiety. I used to have anxiety when I'm writing exams. And so my friends voted me as a latecomer. But what people didn't know is that before an exam, I would always get sick. I would be sweating, I would have a fever, I'd have a running stomach. So before I actually go for the exam, I'll be having all that. And I used to show up late for most of my exams, but people didn't understand that. And at the time, I thought it's normal. But now when I look back, I think I should have gotten help for that, because I don't think it was a normal reaction. I used to be sick, like totally sick. So I guess if there's someone who's having such things, I think it's better that you get checked, because there are medications for that. And medications, something that people talk about, they're always saying that no, they make you slow, they make you feel sleepy, drowsy, and so most people actually stop taking the medication. What's your view on that?
Okay. Okay. Medications, psychiatric medications. Yes, they are needed in some cases. it's understandable that people would stop taking them because of the effects, because these are drugs. And like you've mentioned, the side effects can really be extreme. For some people, they are not even able to function. Some of them become robots, and so they believe that they are better without them. In such a case, I think it's better to discuss with your psychiatrist. Now, let's put the medical background aside and let me talk as me. Psychiatric medications are similar to psychotropic drugs. Okay? So, the effects that they have can really be damaging. As they are helping you, there may be some damage that's taking place. So, if you are given medication for a psychiatric disorder, it's important to take it with measures. Know what medication you are taking, know what it does, know what it's damaging, so that you can either slow down or reverse the damage. Medication is important. However, I don't believe that every single person living with a psychiatric condition needs medication. There are issues such as depression. There are different types of depression and different extents, and some people need medication to, regulate their neurotransmitters. But on the other hand, people who are going through depression, if you ask them, why do you think you're going through depression? A lot of people will tell you it's an issue. They are not living their best lives. Some people are going through depression because of poverty. Some people are going through depression because of a toxic relationship. Some people are going through depression because they maybe have an entitlement mentality and they're not getting everything that they want. So there are certain things that can be dealt with without the use of medication. One, by eliminating that factor. If you are experiencing depression because of poverty, the solution, instead of you getting on medication, is to find a way to get yourself out of that tough financial situation. Because if you stay in that situation and you don't learn how to either get out of it or handle it, you'll be depressed for the rest of your life. And you'll be drinking antidepressants for the rest of your life. There are also certain things that aid the production of the neurotransmitters that we need, such as exercise and eating right. Now tell me, if somebody has mild depression, okay, and you teach them how to cope with that, you teach them how to naturally boost their neurotransmitters, are they going to need medication?
No.
That was my opinion on medication.
So, yes and no.
In extreme cases.
Cases.
But not every case requires medication. I think for some people, putting them on medication will actually make things worse because this medication is addictive. Not all of it is addictive, but then, like I said, everything can be addictive. Some people are dependent on antidepressants, and when they run out, they automatically become sad. There is a need for us as human beings to learn how to function without medication. There's a need for us to learn how to function with what God has given us. God gave us food. God gave us herbs. And the Bible says that the herbs are for our medicine. So, and that's where they get that medication. They modify it. They add their own things. So it would be good for people to actually find healthy, natural and healthy remedies for some of these things.
But if we say that they find remedies for that, now the doctor in me is like, it's coming out. The advantage that modern medicine has is that you know the amount of the active ingredient that someone is taking, unlike the herbs. Because you don't know how much of the active ingredient you're taking. You can either be underdosing yourself or overdosing yourself. And also because herbs, I don't know if they're well researched on, because they can end up damaging other things, shutting down other organs. So I don't know. How can people make sure that they're getting herbs that are safe for them?
As with everything that involves health, consult your doctor. Consult your doctor. Ask them. That's why, medical professionals are there for guidance. So I'm in support of using herbs, but people have different opinions about that. I find it to be a good alternative. Of course, the dosage needs to be monitored, and that's where now the professionals come in. That's where the herbalists come in. I think the herbalist business in Zambia is not, the herbalist industry in Zambia is not yet so exposed, but yes.
Because I feel
So
like someone...
doctors are the only people that we can ask right now.
Yeah, because herbalists, I just feel like people just go and pick things in the bushes. And I'm not saying they don't work, but just the fact that we don't know how much of the active ingredients that we need, we don't know how much is there. So I have a problem with that. And we also don't know the other ingredients that are there, the other active things. So it may end up causing damage. I mean, your brain starts functioning well, but your kidneys start shutting down. So that's why the herbs, I'm a bit on the fence. But I do believe some of them work. So sometimes when we get patients who ask, like, can we use herbs? It's a very difficult question to answer. And I'm actually hoping that I can find a professional herbalist who has studied these things so that they can shed more light on it and how the herbal industry works in Zambia. Because there's some people who just go out, pick things and sell to people. And we've had a few cases where people are actually poisoned and some die, unfortunately. Some come with the kidneys are really affected and their livers. You find that they're shutting down, and people deny when they come to the hospital. You ask them, did you take something? And they always say, no, I didn't take anything. People are not honest. Especially even labor, people will take something so that, it moves faster. And when you ask them, they always say no. So, I don't know. On herbs, I'm not very, very sure.
Everything should be taken with caution and information. Yeah.
So I hope we have herbalists who actually study these things.
I'm sure they're there out there.
Have you taken any herbal things that have helped you?
Yes. So I battle with depression and anxiety. So what I often need help with is anxiety. And what I use is mint and ginger. Those are, so like I take mint and ginger tea.
Those sound very safe.
Yes, I think when I mentioned herbs, we were thinking.
Yes, I was thinking extreme things, like someone goes and gets roots that you don't even know about, you don't know the name. That's what I was thinking of. I wasn't thinking of like things like ginger and things like that.
No, I'm talking about the simple things.
Okay.
The cute things,
Yeah.
I used to take valerian for my anxiety, and it used to work well. I found that with these herbal remedies, mint, even parsley, I take parsley as well. Cloves, those are things that I'll just, put in and make tea. I found that the way those things work are not as aggressive as medication. If you have an anxiety attack, you're most likely to be given something like diazepam, which is heavy and also addictive. And you get knocked out. But then with the things that I have mentioned, they're going to calm you down without actually interrupting your daily activities. And that's why I love my herbs.
Okay. So my mind went deep. I was thinking of, like those people who sell herbs in Kamwala, and they have those speakers and whatnot.
No.
That's That's what I was thinking of. So you mentioned exercise. What other things can help people have a healthier mental health?
Okay. Mindfulness and meditation. I know we're in Zambia. This is a topic that's
Yeah.
like meditation. That's a waste of time. But really, meditation helps you to be in the here and the now, you know, and also to relax. Okay, relaxation. Meditation is good for relaxation and reflection. I also recommend prayer. Prayer, spending time in the Word of God, having a relationship with God, because God is the one who knows the depth of our issues. So, in as much as we may see professionals, the professionals know what they are doing, but then God knows us better, way, way, way better than ourselves. If you can pick only one thing to do, I would pick having a relationship with God over any other coping mechanisms, because the Holy Spirit directs us in the way that we should live. You know, if you rely on the Holy Spirit to lead you step by step, these things like depression, anxiety, yes, they may come, but they will not prosper. At some point, you will reach, the level where even when you sense, okay, depression is coming, because you have that relationship with God, you know that you are stronger than this simply because you are in fellowship with God. So, other coping mechanisms. Human beings are social beings. So, spending time with friends, spending time with people who make you feel good about yourself, not people that you're forcing yourself to spend time with, spending time with people who have positive vibes, positive energy. We were talking about energy, and for sure that if you keep negative people around, you will eventually start to live a negative life. There's so many things that you can do. Another thing is identifying your purpose. Of course, we are born with our purpose, and it's just for us to now discover what that purpose is. And once you start living a purpose-driven life, you are grounded and directed by the goals that you have, the goals that you aim to achieve. And so even the things that come with depression, anxiety, if you just push through those things, once you get to the other side, it's over. Like, you're good. I have so many other tips that yeah.
Well, I'm sure people will follow you for more tips. How can someone recognize that they addicted to something, or they're getting addicted? I'm sure there are people who are doing things like watching porn and they don't think it's a problem, or they're gambling and they actually don't think it's a problem. But how can they know that, okay, this is becoming a problem?
If somebody is asking themselves whether they're addicted or not, chances are that they are
Addicted. Yeah.
So that's number one. For you to question, am I actually addicted? Don't question. You are. Okay. So with addiction, one, how often does this person think about that thing? Let's forget doing, because we already know that people who are living with addiction will tend to do something frequently. Now, how often do they think about this thing even when they are not doing it? Does this person feel uneasy when they are not doing that thing, or when they have not taken the thing that they are addicted to? Okay? Is this habit causing distress to either yourself or the people around you? Okay? So many other questions. Is it affecting you physically or mentally? Addiction often affects people in different ways. There are some people who are addicted to certain substances that they may say, oh no, this one is healthy, it's not toxic, so I can take it every day. But then how is it affecting you on the inside. When somebody is living in addiction, they indulge in that activity despite knowing and even experiencing the negative effects of that addiction. Addiction is like, I don't even know how I can put it. Addiction is like a leash, and the one who is battling with addiction is like a puppy. I won't even say like a big dog, because I think
A big dog can break the leash.
yes, a big
easily.
dog can break the leash easily. But then if a puppy is chained to something, in as much as they may want to escape, they may try to escape, but then when they realize that, this thing is pulling me, it's like, okay, let me just stay in this. This is the situation. This is who I am. This is how my life will always be. Have you given up on life because of that thing? Addiction will occupy you like I don't know, like a demon, And some people say that addiction is spiritual. And I believe that there is some truth to that, It's like you are in bondage. You can't leave no matter how much you try to leave. So if you feel like you are being bonded by something, then you are most likely addicted to that thing. It's not love. It's toxic.
Yeah. So I remember something in school about addiction. We said that if someone is going out of their way to get to that thing, it's like nothing really matters, whether your family neglects you or people give up on you. You don't care. All you want is to just get that thing, which is, when you think about it, it's very, very, very unhealthy.
Yes.
Yeah.
Actually, a lot of people do care. They just care about the drug more, or the addiction more, or they care about their feeling more, because a lot of people actually will experience mental health symptoms because of withdrawing from addiction, withdrawing from a certain, maybe, I don't want to say drug, because so many things can be addictive. If you haven't...
Well, even love is a drug.
Yes. You haven't seen that person, you even become sick, you become depressed. That's not love, that's addiction.
Okay. And how do you advise people to cope with this addiction? And I know there are tips in your book, how to cope with dope. So you guys should get that book. So what are some of the things that you advise people to do?
The first step is to accept. Accept that you are living with addiction. Then now you ask yourself, am I willing to change this, or do I just want to live with it while doing other things? It's easy to say yes, but some people don't want it bad enough. You have to want to recover as bad as you want to breathe, as much as you want to be alive. So it starts from the mind. You decide what you're going to do with your life. Decide the life that you want to live, and then now you start making those steps. But if you're trying to quit, I was addicted to alcohol at some point, and I don't drink anymore. And how I did it was very simple. So yes, let me talk less from the professional angle and more from my experience, because I know that that's what works. So when I was planning to quit alcohol, I actually started planning like years ahead. I just kept on saying one day. Then when I decided, okay, I'm going to quit, I started educating myself about the dangers of alcohol. I already knew the dangers of alcohol, but I needed my mind to fully understand that I'm better off without this thing than with this thing. So I started, getting that information through even just like videos, TikToks, the simple things where it's like somebody is talking to you. So I was having conversations with these people online. And what that did was my mind understood the dangers so much that my body started reacting to that. Whenever I would drink or try to drink, I would react in a very terrible way. And I just started saying, Moa, wanikana. But it's actually me who decided that I won't have that in my life. Okay. Then when I finally made the decision, the first thing I did was I separated myself from the friends that I used to drink with. When you're trying to quit something, in as much as you love the people, they are good people, yes, but then they are causing you to be in addiction. So staying away from the triggers, staying away from the enablers will really help you to stay sober. It might not take away the urge, but it will give you that push. Okay, I can go without alcohol for 1 week without the distraction. And there are some people that I separated myself from, and I only started, like I only got ready to see them physically after a year.
Wow.
Yes. To me, there were distractions. Like, you know what? This is where I'm going. This person is going to bring this in as much as they don't intend to cause harm. This is what's going to happen. And then another thing that I did was that I found alternatives for that activity. I would drink often. Every weekend, I would be drinking. I never really used to like to go out much, so I would drink from home. Now, me separating myself from my friends meant that I was home more often. So while being home, I found alternatives for the activities that I would do. Okay, what am I going to do on a Friday night? How about I catch up on a movie? The simple things, doing things that you enjoy. So there's that, and there's many other things that you can do. But I think for a start, that would help somebody to actually begin their journey of recovery. And remember that once you develop an addiction, the terms, when you stop taking that thing, you'll forever be a recovering addict, because recovering from addiction is a daily battle. You will have the temptations. You will have the times where I have times when I'm so frustrated. Life is, and it's like, you know what? That's why it's a coma. But I tell myself, okay, those are just thoughts. I don't have to entertain them. I don't have to let them influence my emotions, because I know once they influence my emotions, they're going to influence my behavior. And I mean, there are liquor stores everywhere. Yeah. But the biggest thing that helped me to recover from addiction was God. I loved alcohol so much that I knew I couldn't do it on my own. So that time that I was watching the videos, I would pray to God every day to help me get out of this thing. And the day that I quit, it was like magic. It was like I had never drunk.
Was this before. One day?
Yes. I told God, help me to quit alcohol, and don't make it hard, because I'm your bundle of joy. Okay. So once I did my part, God came through and made it so easy. I just woke up one day and said, I've stopped alcohol. And from that day, even just the smell of alcohol is so terrible. And but God.
Okay, that's very nice. I heard someone who was trying to quit smoking. So he said, where I used to keep my cigarettes, I started keeping gum. So every time I felt the urge, because it was a habit. I feel the urge, I just got here, I know that I'm going to find a cigarette. But now I was finding gum. And so he replaced that urge with something else. So he started chewing gum. And he said he was chewing a lot of gum. And people would always ask, like, why are you chewing so much gum? But he knew what he was doing. He knew what he was fighting. So I think, yeah, people should just replace the urge with something. I know it's easier said than done, obviously, but yeah, I think it works, and it worked for you. You replaced your urge with movies, and I think people can get something from that.
On replacing the urge, right, in the example that you've given, so that person, I don't want to say this. Okay, how do I put it? From what you've explained, it seems to me like that person has not recovered from addiction. They've just switched out their addiction.
Yeah.
So the person is addicted to gum. The thing with depression is that it often stems from something deeper than just wanting to take the thing. Okay. So there's also a need to understand what it is that you are lacking, what it is that you are longing for. A lot of people who grew up in broken homes, people who lost their parents at a young age, end up living in addiction because of that void that they had growing up. So not to say that that's the only thing that causes addiction, but then it's important to look within and see, okay, what is the problem that this addiction is trying to solve. I know that I was addicted to alcohol because I was depressed. I was trying to run away from depression. Now, the day that I decided to quit alcohol, I also told myself, I am going to deal with depression because I don't want this thing to be an excuse for me to go back. 1. 2, I wanted to solve the problem once and for all. You can never be fully healed, but I think you can be healed enough to make better decisions. So, yes, let's not switch out our addictions.
Okay, but can you have a good addiction? Because, I mean, comparing being addicted to cigarettes, he switched it for gum. So are you able to have good addictions? And you also switched addictions. You switched
I'm
from
not addicted to
alcohol. No, you're addicted to what? Addicted to God? Church, maybe? So you also switched your addiction. So can you have a good addiction? Are there good addictions?
Well, addiction in its definition is always negative.
Yeah,
But
maybe.
I get the question that you are trying to ask, and
Or maybe can we say, are there less harmful addiction? Maybe. I don't know.
I guess so. Different addictions have different levels of harm. So definitely some are less harmful than others, like reading.
It sounds like a good addiction.
Yes, I think I'm addicted to reading, though I told myself that I won't be controlled by anything. So sometimes even when I want to do it, when I'm supposed to be doing something else, I'm like, no. You're supposed to be doing this and not that. Sometimes I even tell myself, okay, I should spend some time just in silence so that I can see that I can live without anything else. Some people who are in addiction just do it because they want to be doing something, and that's either the only thing that they know how to do, or it's the thing that they enjoy the most, or what's easily accessible to them.
So basically, addiction is not healthy.
No, not at
Whether
all.
it's a good thing, it can be unhealthy. Yeah. Too much of
Anything that is
anything.
done excessively. Whenever something just starts to control you, whether it's a good thing or a bad thing, it's a bad thing. Because not even God wants to control us. You feel me? So why should we let things that we found on this earth control us?
Okay. I get your point. Hey, I really do. So for people out there, families, friends who who are struggling with mental health issues and they know they're struggling, where can they get help, especially here in Zambia? Where can they find help?
Okay. Chanama Hospital.
Yeah, and
Yes.
you just know how everyone just doesn't like how Chinama Hospital sounds. When you tell someone, oh, go to Chinama, and they're like, hey, me, Chinama, I'm not crazy. Kwama shirukuja, you know?
Yeah.
So,
But it's not like that. It's not like that. I go to Chinama for help, for my depression and my anxiety, and it's chilled. It's not like when you go there, they'll immediately admit you and whatnot. I think the label has actually led to detrimental systems. The help seeking behavior in Zambia, especially for mental health, is very, very, very poor.
yeah.
But yes, if you need help, go to Chinama, and if you want to go to a private, you can ask for recommendations from there.
Mm-hmm.
Yes.
Are there any things, any groups, any support groups that are out there where, Chinama is in Lusaka, and we have people struggling all over the country. So are there some like WhatsApp groups, Facebook groups that are there to help people struggling with different mental illnesses?
Okay, so I actually have a group, Mental Illness Zambia, that's a support group for different mental health issues, and anybody is free to join.
Okay, that's on Facebook?
On WhatsApp.
On WhatsApp.
On WhatsApp. We will be having physical sessions very soon.
Mm-hmm.
So, yes, if anybody wants the information, they can follow me and ask.
Okay, so that's Namatama Luwinda.
Yes.
Yes, so when they follow you, they just give you the information and you add them to the group and things like that. Okay, all right, that's very good. Any last words for our listeners and viewers? Any helpful tips?
I've given a lot of
Okay, yeah, you have. You have. Any last words anyway for them?
Yeah. The one thing that I can say is the universal cure for all mental health disorders is love.
Mm-hmm.
Love, 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 love. Love conquers all. So start with receiving the love of God. God loves each and every one of us so much, and he loves us unconditionally. The love of God, once you have really the love of God, it's very difficult for you to long for other things beyond what God intends for us. And when you experience the love of God in its full form, it helps you to love yourself better and even know truly what real love is. And so when you get to that point, it's even difficult for you to accept anything that is not love in whatever form, be it disrespect, be it what, those are things that you will stop tolerating. Some people find themselves in depression because they tolerate nonsense from everyone. Yes, but if you love yourself enough, if you genuinely love yourself enough, you will get better and you will live your best life despite anything. Psychiatric disorders cannot be cured, but they can only be treated. But it is possible to live your best life while you are living with a mental health disorder. I'm doing it, and I believe that every person can do it too.
Okay, that's a very, very good message for everyone. Thank you so much for joining me. I hope we can have another chat about toxic relationships.
Definitely.
Because so many women ask you about toxic relationships. I was like, wow, it must be a problem. So I hope we can have a discussion on that.
Sure, no problem.
Okay. So this was Health with Dr. Yvette Maseka. Don't forget to subscribe. Bye.